Penis rings might be the simple solution to stronger, longer-lasting erections that most men over 60 never consider. While 70% of elderly men struggle with maintaining firmness, many dismiss this FDA-approved medical device as ineffective. I'm Dr. Grace Miller, a board-certified urologist with 25 years treating senior men's health. What if this small silicone ring could restore your confidence without pills or surgery? The first and most common mistake I see in my practice is men purchasing penis rings without proper sizing. It sounds simple enough. Order online, try it out, see what happens. But here's what most men don't realize. Getting the wrong size isn't just ineffective, it can be genuinely harmful. Many men come to me frustrated after buying their first ring online. They measured nothing, consulted no one, and simply guessed based on what looked reasonable in a product photo. The reality is that penis ring sizing is far more precise than most people understand. The diameter must match your specific penile circumference to create optimal blood restriction without cutting off circulation entirely. When a ring is too tight, the consequences go far beyond simple discomfort. The excessive pressure can cause tissue damage, nerve compression, and painful swelling that persists long after removal. I've treated men who developed bruising, numbness, and in severe cases, skin breakdown from rings that compress too aggressively. On the other hand, a ring that's too loose provides absolutely no therapeutic benefit. The blood flows out just as easily as it would without any device at all. The emotional toll of poor sizing often proves more devastating than the physical discomfort. Men who experience pain or see no improvement frequently abandon the idea entirely, convinced that penis rings simply don't work. They've invested hope, money, and courage into trying something new, only to conclude they're beyond help. This premature abandonment prevents them from discovering that the concept was sound. They just needed the right fit. The solution requires either professional consultation or investing in adjustable rings that allow for fine-tuning. Many medical supply companies offer sizing guides, and some urologists provide fitting consultations. Adjustable rings, while slightly more expensive, eliminate guesswork and allow men to find their optimal compression level through careful experimentation. Even with proper sizing, timing mistakes create new problems that can turn a helpful tool into a dangerous one. Have you ever lost track of time during intimate moments? What feels like minutes can easily stretch into an hour or more, especially when you're finally experiencing the firmness and confidence you've been missing. This natural tendency to lose awareness of time becomes dangerous when wearing a penis ring, yet it's one of the most overlooked safety risks I encounter. Emergency room physicians regularly report cases of men arriving with rings that have been left on far too long. These aren't careless individuals. They're often responsible men who simply became absorbed in the moment, or more commonly, fell asleep afterward during that peaceful, relaxed state that follows intimacy. What started as a positive experience quickly transforms into a medical emergency. The science behind this danger lies in tissue hypoxia, the medical term for insufficient oxygen reaching your cells. When blood flow is restricted for extended periods, the tissues begin to starve. Unlike other parts of your body that can tolerate brief periods of reduced circulation, the delicate tissues of the penis require consistent blood flow to remain healthy. After 30 minutes of restriction, cellular damage begins. After an hour, that damage can become irreversible. The physical consequences escalate rapidly. Initial symptoms include numbness, color changes from pink to purple or blue, and a cold sensation. If the ring remains in place, nerve damage occurs, followed by tissue death. I've seen men require emergency surgery to remove rings that became embedded in swollen tissue, and in extreme cases, permanent damage that affects both function and sensation. Perhaps more devastating than the physical trauma is the emotional aftermath. Men who experience these complications often develop severe anxiety around any form of sexual activity. The fear of another emergency, combined with shame about the incident, can destroy years of progress in rebuilding intimate relationships. Many become so traumatized they refuse to try any form of treatment, even safe alternatives. The solution is remarkably simple yet requires discipline. Never wear a penis ring for more than 30 minutes. Set a timer on your phone before you begin. Make ring removal part of your post-intimacy routine, just like washing your hands or brushing your teeth. Some men find it helpful to involve their partner in this safety protocol, making it a shared responsibility rather than something to remember alone. Timing isn't the only safety concern, with improper materials creating their own set of dangerous complications. What drives a man to fashion a penis ring from rubber bands, hair ties, or even metal washers from the hardware store? The answer is usually a combination of desperation, embarrassment about purchasing a medical device, and the mistaken belief that a ring is a ring. This dangerous improvisation represents one of the most alarming trends I've witnessed in recent years. The emergency department data tells a sobering story. Urological emergencies involving makeshift constriction devices have increased significantly over the past decade. Men arrive with everything from rubber bands that have snapped and embedded in skin to metal rings that require industrial cutting tools to remove. What starts as a creative solution to avoid an awkward purchase ends with surgical intervention and lasting complications. The fundamental problem lies in material science. Medical-grade silicone rings are engineered with specific properties: controlled elasticity that provides appropriate pressure without cutting off circulation, smooth surfaces that won't tear delicate skin, and breakaway features that allow emergency removal. Household items possess none of these safety characteristics. Rubber bands can snap without warning, hair ties contain rigid components that cut skin, and metal objects create pressure points that cause tissue death within minutes. The physical damage from improvised devices often requires surgical repair. I've treated lacerations that needed multiple sutures, infections that required weeks of antibiotic treatment, and tissue damage that permanently altered sensation and function. Unlike complications from proper medical devices, injuries from household items tend to be severe and unpredictable because these materials weren't designed for sustained contact with human tissue under pressure. The psychological trauma compounds the physical injuries. Men who experience these complications often feel profound shame, not just about the injury itself, but about the circumstances that led to it. This embarrassment frequently delays medical treatment, allowing infections to worsen and damage to progress. The fear of explaining how the injury occurred can prevent men from seeking the immediate care these situations require. The solution requires a fundamental shift in perspective. Your sexual health deserves the same investment as any other aspect of your medical care. FDA-approved medical-grade silicone rings cost between $20 and $50, a fraction of what you'd spend on a single emergency room visit. Reputable manufacturers design these devices with safety features specifically for intimate use, including emergency release mechanisms and materials that won't cause allergic reactions or tissue damage. Even safe materials fail without proper application techniques, creating unnecessary risks that proper education easily prevents. Picture this scenario. You've invested in a quality penis ring, read the safety guidelines, and you're ready to try it for the first time. But in your eagerness or nervousness, you skip what seems like an unnecessary step: lubrication. You attempt to roll the ring down a dry penis, and suddenly what should be a smooth process becomes a painful struggle that leaves you questioning whether this device could ever work for you. Research from sexual health clinics reveals that improper application technique accounts for nearly 40% of early discontinuation among penis ring users. The most common complaint involves pain, tearing, or abrasions that occur during the initial application process. Men often assume that if they can stretch the ring with their hands, it should slide easily onto the penis without assistance. This assumption overlooks the fundamental differences between the tough skin on your fingers and the delicate, sensitive skin of the genital area. The penile skin contains a higher concentration of nerve endings and blood vessels than most other parts of the body, making it particularly susceptible to friction injuries. When a ring is applied without proper lubrication, the dragging motion creates microscopic tears in the surface tissue. These injuries may seem minor initially, but they create entry points for bacteria and significantly increase infection risk. The skin's natural healing process also means these small tears can become painful during subsequent attempts to use the device. Beyond the immediate physical discomfort, improper application creates lasting psychological barriers to sexual enjoyment. When your first experience with a potentially helpful device involves pain and frustration, your brain forms negative associations that persist long after the physical injuries heal. Many men report developing anxiety about any form of sexual activity after traumatic application experiences, fearing that intimacy itself will become associated with discomfort. The solution involves adopting proper application techniques that prioritize both safety and comfort. Always use a high-quality water-based lubricant before attempting to apply any penis ring. Apply the lubricant generously to both the ring and the penis, ensuring complete coverage. The ring should slide smoothly into position without requiring excessive force or causing any pulling sensation on the skin. If you encounter resistance, add more lubricant rather than pushing harder. Proper technique also involves timing. Apply the ring when you're partially but not fully erect, as this allows for easier positioning while still achieving the desired restriction once full arousal occurs. Take your time during the process. Rushing leads to mistakes and injuries that could have been easily prevented. Application problems pale compared to the serious risks that emerge when men ignore medical contraindications that make penis ring use genuinely dangerous. When was the last time you honestly assessed your health conditions and how they might affect new treatments? The most dangerous assumption older men make about penis rings is that age alone determines safety, ignoring the complex web of medical conditions that can turn a helpful device into a serious health risk. This oversight has led to some of the most preventable complications I've encountered in my practice. Clinical data reveals alarming patterns among men who experience ring-related injuries. Over 60% have underlying conditions that increase their risk: diabetes, peripheral neuropathy, blood clotting disorders, or cardiovascular disease. These men often dismiss medical warnings as overly cautious, reasoning that if the device is available without prescription, it must be universally safe. This logic fails to account for how common age-related conditions fundamentally alter how the body responds to external pressure and restriction. Diabetes presents perhaps the most insidious risk because it damages both circulation and sensation. Diabetic neuropathy reduces feeling in the extremities, including the genital area, meaning men may not notice when a ring becomes too tight or causes tissue damage. Poor circulation, another diabetic complication, means injuries heal slowly and infections develop easily. What might be a minor irritation for a healthy man becomes a serious wound for someone with compromised healing abilities. Blood-thinning medications commonly prescribed for heart conditions or stroke prevention create additional dangers. These medications prevent normal clotting, so even minor trauma from an ill-fitting ring can result in significant bleeding or bruising. Men on warfarin, clopidogrel, or newer anticoagulants face risks that extend far beyond the typical safety concerns associated with penis rings. The physical consequences of ignoring medical contraindications often require emergency intervention. I've treated serious infections that developed from unnoticed injuries, blood clots that formed around improperly fitted rings, and tissue damage that required surgical repair. These complications typically progress rapidly in men with underlying health conditions, often requiring hospitalization and aggressive treatment. The emotional devastation extends beyond the immediate medical crisis. Men who experience serious complications often develop profound mistrust of their own judgment about health decisions. They may become reluctant to try any new treatments, even beneficial ones, because they've lost confidence in their ability to assess risk appropriately. Relationships suffer as partners become fearful about future intimate encounters, worried that pleasure might again lead to medical emergencies. The solution requires honest conversation with your healthcare provider before trying any new sexual health device. This isn't about getting permission. It's about understanding your individual risk profile and learning how to use devices safely given your specific health conditions. Some men may need modified approaches, closer monitoring, or alternative treatments altogether. Medical clearance means nothing without understanding realistic expectations about what penis rings can and cannot achieve for your particular situation. How many of us secretly hope that one simple device might turn back the clock 30 years? The fantasy of rediscovering our 20s through a silicone ring represents one of the most persistent misconceptions about penis ring therapy. Men approach these devices with dreams of marathon sessions and rock-hard erections that last for hours, setting themselves up for profound disappointment when reality falls short of these impossible expectations. Survey data from sexual health clinics paints a clear picture of this expectation gap. Nearly 70% of men seeking penis ring therapy report hoping to achieve erections, like when I was young, while only 15% have realistic understanding of what these devices actually accomplish. The disconnect between fantasy and function creates a setup for failure that has nothing to do with the device's actual effectiveness and everything to do with unrealistic goals. Penis rings work within the constraints of your body's current capabilities. They cannot restore blood vessels damaged by decades of diabetes, reverse arterial hardening from cardiovascular disease, or eliminate the natural changes that occur with aging. These devices excel at helping you maintain erections you can already achieve, but they cannot create erections from nothing. If underlying vascular damage has progressed significantly, no amount of external pressure will restore youthful function. The physical consequences of chasing impossible standards often involve overexertion and risky behavior. Men become frustrated when rings don't deliver miraculous results, leading them to experiment with tighter fits, longer wear times, or combinations with other devices or medications. This escalation frequently results in injuries that could have been avoided with appropriate expectations about what was actually achievable. The emotional toll of unmet expectations can be devastating. Men who approach penis rings as magic bullets often experience their limitations as personal failures rather than realistic boundaries. This disappointment frequently spirals into depression, relationship conflict, and complete withdrawal from intimate activities. Partners may feel blamed for not being exciting enough to overcome the device's limitations, creating tension that extends far beyond the bedroom. Understanding penis rings as assistive tools rather than cure-all solutions transforms the entire experience. Like reading glasses that help you see the newspaper or a cane that provides stability while walking, these devices work best when viewed as helpful supplements to your existing capabilities. The goal isn't to recapture your youth. It's to maximize what your body can still do and find satisfaction within those realistic parameters. Success with penis rings requires redefining sexual satisfaction around connection, pleasure, and intimacy rather than performance metrics from decades past. Many men discover that while they may not achieve the rigid erections of their 20s, they can still experience fulfilling sexual relationships that prioritize mutual enjoyment over duration or firmness measurements. Realistic expectations help tremendously, but partner communication remains crucial for transforming individual understanding into shared intimate success. Why do so many men treat penis rings like classified information, hiding their use from the very people who could help make the experience successful? The impulse to manage erectile difficulties in secret runs deep, but when it comes to intimate aids like penis rings, secrecy often undermines the very benefits you're hoping to achieve. This hidden approach to sexual health creates more problems than it solves. Relationship counselors specializing in senior sexuality report a troubling pattern: men introducing sexual aids without discussion, leaving partners confused, hurt, or even frightened by unexpected changes in sexual encounters. Partners may notice differences in firmness, duration, or sensation without understanding the cause, leading to anxiety about their own performance or attractiveness. Some worry that sudden improvements mean their partner has been faking satisfaction for months or years, while others become concerned about infidelity or secret medical conditions. The physiology of sexual response involves two people, not just the person wearing the device. Penis rings can change the feel and rhythm of intimacy in ways that affect both partners. Without preparation or explanation, these changes can be jarring rather than pleasant. Partners may unconsciously adjust their movements or expectations in ways that work against the device's benefits, or they may become overly cautious about causing discomfort, reducing the spontaneity that makes intimacy enjoyable. Physical complications increase significantly when partners don't understand what's happening. Safety protocols like the 30-minute removal rule become nearly impossible to maintain when only one person knows timing matters. Partners can't assist with proper positioning or recognize warning signs of problems if they're unaware a device is being used. This ignorance can transform minor issues into serious complications simply because the informed partner tried to handle everything alone. The emotional distance created by sexual secrecy often proves more damaging than the original erectile difficulties. Intimate relationships thrive on vulnerability and shared experience. When you hide something as fundamental as how you're managing sexual health, you create barriers that extend far beyond the bedroom. Partners may sense the deception even if they can't identify its source, leading to general feelings of disconnection and mistrust that affect all aspects of the relationship. Successful penis ring use requires treating your partner as an ally rather than an audience. This means having honest conversations about your concerns, explaining what you're trying to achieve, and discussing how the device might affect your shared intimate experiences. Many couples find that these discussions actually strengthen their relationship by opening previously avoided topics about aging, health, and sexual satisfaction. The conversation doesn't have to be complicated or clinical. Focus on your desire to maintain closeness and pleasure together, explaining that you found a tool that might help. Discuss practical matters like timing, positioning, and safety protocols. Most importantly, emphasize that this is about enhancing your connection, not replacing anything that was lacking in your partner. Communication helps with acceptance and success, but even the most understanding partners can't compensate for maintenance neglect that turns helpful devices into sources of infection and health problems. Would you reuse a contact lens without cleaning it? Wear the same underwear for weeks without washing? The idea seems absurd, yet countless men treat penis rings with shocking disregard for basic hygiene principles. This oversight transforms a beneficial medical device into a breeding ground for dangerous bacteria that can cause serious infections affecting both sexual and urinary health. Microbiological studies of used penis rings reveal disturbing patterns of bacterial contamination. Devices that haven't been properly cleaned harbor colonies of E. coli, Staphylococcus, and other pathogenic organisms that thrive in warm, moist environments. These bacteria don't simply disappear between uses, they multiply, creating increasingly concentrated colonies that pose escalating health risks with each exposure. The intimate nature of penis ring use means these bacteria have direct access to the urethral opening, creating perfect conditions for ascending urinary tract infections. The genital environment provides ideal conditions for bacterial growth. Warmth, moisture, and organic material from natural secretions and lubricants. When a penis ring isn't thoroughly cleaned after use, it becomes a reservoir for these organisms. Each subsequent use reintroduces concentrated bacterial colonies directly to the most vulnerable tissues, overwhelming the body's natural defense mechanisms and creating conditions ripe for infection. The physical consequences of poor ring hygiene extend far beyond simple irritation. Urinary tract infections in older men can quickly progress to serious kidney infections requiring hospitalization. Bacterial skin infections around the genital area heal slowly, and often become resistant to standard antibiotics, requiring prolonged treatment with stronger medications that carry their own risks and side effects. Some men develop chronic inflammatory conditions that make any form of sexual activity painful for months after the initial infection. The psychological impact of hygiene-related infections often proves more lasting than the physical symptoms. Men who develop painful infections after using penis rings frequently associate all sexual activity with potential illness and discomfort. This fear-based response can persist long after the infection clears, creating anxiety that makes erectile difficulties worse rather than better. Relationships suffer as men become reluctant to engage in any intimate contact, fearing they might spread infection to their partners. Proper maintenance requires establishing consistent cleaning protocols that become as automatic as brushing your teeth. Immediately after each use, wash the ring thoroughly with warm water and antibacterial soap, paying special attention to any textured surfaces where bacteria might hide. Allow the device to air dry completely before storing it in a clean, dry location. Never store a damp ring in closed containers where bacteria can multiply in the absence of air circulation. Monthly deep cleaning with a diluted bleach solution or specialized medical device cleaners helps eliminate any bacterial buildup that regular washing might miss. Replace rings periodically according to manufacturer recommendations, as even well-maintained devices eventually develop microscopic scratches and wear patterns that harbor bacteria despite thorough cleaning. Clean rings help prevent dangerous infections, but combining them with other erectile dysfunction treatments requires careful medical supervision to avoid potentially life-threatening complications. The temptation to stack treatments seems logical when individual approaches provide only partial results. If a penis ring helps somewhat and Viagra improves things a little more, combining them should create even better outcomes, right? This more is better mentality represents one of the most dangerous assumptions men make about erectile dysfunction treatments, leading to medical emergencies that could easily be prevented with proper understanding of how these therapies interact. Emergency department statistics reveal a troubling trend in combination therapy complications. Men over 65 who combine penis rings with phosphodiesterase inhibitors like Viagra, Cialis, or Levitra experience cardiovascular events at rates nearly 3 times higher than those using single treatments. The problem isn't that either treatment alone is particularly dangerous. It's that their combined effects on blood pressure and circulation can create unpredictable and potentially fatal interactions. The cardiovascular system operates within narrow parameters, particularly in older adults who often have underlying heart disease or blood pressure irregularities. PDE5 inhibitors work by dilating blood vessels throughout the body, not just in the penis. When you add mechanical blood restriction from a penis ring, you create competing forces that can overwhelm the body's ability to maintain stable circulation. Blood pressure can drop precipitously, leading to dizziness, fainting, heart rhythm disturbances, or even cardiac arrest. Priapism, prolonged, painful erections lasting more than 4 hours, occurs with alarming frequency when mechanical and pharmaceutical approaches are combined inappropriately. The ring prevents blood from leaving the penis while medications increase blood flow into the area, creating a dangerous trap that requires emergency intervention to prevent permanent tissue damage. Emergency room procedures to resolve priapism are traumatic and painful, often involving needle drainage or surgical intervention. The psychological trauma from combination therapy emergencies often proves more devastating than the physical complications. Men who experience cardiovascular events or priapism during intimate moments frequently develop severe performance anxiety that makes any sexual activity terrifying. Partners may become afraid to engage in intimacy, worried that pleasure might again lead to medical crises. These fears can persist for years, effectively ending sexual relationships even after physical healing is complete. Safe combination therapy requires careful medical supervision and gradual introduction of treatments. Never combine penis rings with any erectile dysfunction medication without explicit approval from your prescribing physician. Start with the lowest effective doses and never exceed recommended timing limits for either treatment. Most importantly, understand that some combinations may never be safe for your particular health profile, regardless of how well you tolerate individual treatments. If you're currently using multiple approaches without medical oversight, schedule an immediate consultation to review your regimen. Your physician can assess interaction risks, adjust dosages if combinations are appropriate, or recommend alternative strategies that achieve your goals more safely. Even with careful medical guidance and safe combination protocols, knowing when to discontinue treatments entirely becomes essential as health conditions evolve and treatment effectiveness changes over time. Sometimes the hardest medical decision isn't knowing when to start a treatment, it's recognizing when to stop. The final and perhaps most critical mistake men make with penis rings involves clinging to devices that no longer serve them well, ignoring clear signals that their bodies have changed and their treatment needs require reassessment. This reluctance to acknowledge when a once helpful tool has become ineffective or even harmful can lead to years of unnecessary discomfort and missed opportunities for better solutions. Longitudinal studies tracking penis ring users over 5-year periods reveal concerning patterns of diminishing returns coupled with increasing complications. Men who initially experience significant benefits often report gradual decreases in effectiveness over time, yet many continue using devices despite mounting evidence that their bodies no longer respond appropriately. The psychological investment in a treatment that once worked can blind men to obvious signs that circumstances have changed. Aging affects every aspect of vascular and neurological function, meaning that treatments effective at 65 may become inappropriate or dangerous by 75. Diabetes progression can eliminate sensation needed to detect ring-related problems. Cardiovascular changes may make even mild blood restriction risky. New medications can create drug interactions that weren't problematic when ring use began. The body's ability to heal from minor injuries decreases with age, making complications from poorly fitting or overused rings more serious and longer lasting. The physical consequences of ignoring discontinuation signals often progress insidiously. What starts as mild discomfort during use gradually escalates to persistent soreness, skin changes, or circulation problems that affect daily life. Men may develop chronic inflammation, persistent numbness, or scarring that makes any form of sexual activity uncomfortable. By the time these problems become severe enough to seek medical attention, reversing the damage often requires extensive treatment and prolonged recovery periods. The emotional cost of clinging to outdated treatments extends beyond personal frustration. Men who persist with ineffective devices often become increasingly isolated from their partners, frustrated by repeated failures, and increasingly convinced that no solutions exist. This tunnel vision prevents them from exploring newer treatments, technologies, or approaches that might provide better outcomes with fewer risks. The fear of admitting that a once successful strategy no longer works can trap men in cycles of disappointment and declining sexual health. Regular reassessment represents the key to long-term sexual health success. Schedule annual reviews with your healthcare provider to evaluate not just how well your current treatments are working, but whether they remain appropriate given changes in your overall health status. Be honest about decreasing effectiveness, increasing discomfort, or new concerns that have developed since you started using a penis ring. Modern erectile dysfunction treatment offers more options than ever before. Newer medications, improved devices, innovative therapies, and surgical techniques continue to evolve. What represents the best treatment today may be superseded by better alternatives within a few years. Staying informed about developments in sexual health treatment ensures you're not missing opportunities for improved outcomes. The goal isn't to use penis rings forever. It's to maintain satisfying sexual relationships throughout your life. Sometimes that means recognizing when it's time to move beyond treatments that served you well in the past and embrace new approaches that better match your current needs and capabilities. This wisdom, more than any device or medication, represents the foundation of lasting sexual health and relationship satisfaction.